Hello everybody, greetings and welcome. It's Peter Cass, and today we're going to talk about the sick kid. So I'm just on the job in the emergency department. Thought I'd quickly talk to you about the sick child. So let's talk about it quickly. So a sick kid can be a significant issue for us in the emergency department, and I'm talking about those children less than 6 months of age, usually 3 months of age, and they come into the emergency department with inconsolable crying. We must be careful not to miss the following diagnoses in this age group. So Sic Kid, SICKID, stand for certain things. So let's have a look at it. So the first thing we've got to be careful not to miss is S for sepsis. Septic children can have inconsolable crying, and what's considered to be normal crying is for up to about 3 months, up to 3 hours of crying per day, so don't miss sepsis. The I in the Sic Kid mnemonic stands for intussusception or other abdominal complaints. So a child can have intussusception or a volvulus or appendicitis. Now, in intussusception, the child will have periodic pulling their knees up, they'll have significant abdominal contractions and pain. The difference between that and simple colic will be that in between these episodes of pulling the legs up and crying, the child will be unwell. A volvulus is a true emergency and occurs in the first 3 months of life. We've got to be careful not to miss this in a child. And of course, appendicitis can be something else that occurs. It's not that common in the very young. However, almost what we consider standard of care today is that we can miss it because none of the signs are really very good in localizing. So that's the abdominal complaints. So sepsis, I for intussusception and abdominal complaints, C for cardiac abnormalities. So we're either talking about congenital abnormalities or we're talking about arrhythmias. The congenital abnormalities can be congenital cyanotic heart disease or otherwise. The three things you've got to really look for in children are, do they have a murmur? Do they have problems with feeding? So that do they get diaphoretic with feeding? And are they cyanosed? And does that cyanosis not disappear when you put oxygen on them? And the second thing is you've got to look for arrhythmias, and usually SVT is what we're looking for. So children that are looking particularly unwell may have an SVT and we're not picking it up. So you've got to have a look at that ECG. In the second part of the mnemonic, the kids part, Kawasaki's disease. So we've got to be careful not to miss that. And Kawasaki's disease is usually a fever for several days, and they'll have 4 or 5 signs, 4 out of the 5 signs. So the 5 things that they can have will be, they'll have an ananthem, which is cracking and redness of the lips together with a strawberry tongue. They'll have conjunctival injection with pericorneal sparing. They will have an exanthem. They will have edema and redness of the palms of the hands and feet. And they will have anterior cervical chain lymph node involvement. This Kawasaki's disease, an interesting one, an important one not to miss, because they can have significant cardiac vessel abnormalities, and these children require immunoglobulin and high-dose aspirin. The I in the kid stands for injury. Let's make sure that these children are not injured because they can't tell you what's happening, and certainly let's make sure that the children don't have a non-accidental injury. And the D stands for don't grow, so there's a failure to thrive. And really we should be looking for children in the first 3 months of life should be putting on about 30 grams a day at a minimum. So make sure there's no inborn aneurysm, metabolism, or some other diseases such as cardiac diseases causing them fail to thrive. So these are the true pediatric emergencies. Remember it by remembering Sic Kid, SICKID, C for sepsis, I for intussusception, other abdominal complaints, C for cardiac abnormalities, K for Kawasaki disease, I for injuries, and D, they're not growing. So look this up on the blog, look at this video again, have a look at the video on Kawasaki's disease, and I hope this helps you. Cheers.